Hi everyone, I'm Dr. Joseph Parvizi. I'm a professor of neurology here at Stanford Medical Center. I'm one of the inventors of Rapid Response EEG system, and I'm here to explain how the system is being used at Stanford ED and which patient populations are prime candidates for this technology, how the workflow is set up, and how the AI Clarity algorithm, which is an artificial intelligence based algorithm, will empower the ED physicians to make the more precise decisions in their assessment of patients who might be having seizures. First, let's talk about the candidate patient populations at risk and those who will benefit most from this technology. Here you see a list of those candidate patient populations. Patients who are altered and there's no explanation for their altered mental status, or patients who have had witnessed clinical seizure or convulsive status epilepticus and now they are not returning to baseline. Is it because of the benzodiazepine that they received en route, or is it because they are postictal, or is it because they are having non-convulsive status epilepticus? And also patients who have altered mental status that is out of proportion for the underlying CNS problem. The patient might have had stroke, acute or chronic, but doesn't explain the magnitude and the depth of altered mental status in this patient. For example, a patient post cardiac arrest who, after resuscitation, is not waking up, or a patient with sepsis, or a patient with meningioma who's acting aphasic, and the tumor itself doesn't explain the extent of alteredness. And of course, lastly, those who are having episodic or repetitive movements, including shaking and presumably convulsions that might be psychogenic or might be concerning for seizures. Now that we have reviewed which patient populations will benefit from this technology, let's review the workflow. Patient is identified. ED physician puts the EEG order in electronic medical record system. ED technicians are notified, and they are the ones that will set up the Ceribell system. In the video that you will be seeing, you can appreciate how easy it is to set up the system, and anyone with minimal training will be able to do so. So once the Ceribell EEG is set up, ED physician will be notified by the ED technologist, and the physician can go to the bedside to listen to the sound of the brain to determine if the patient is having seizure, or they can just wait 5 minutes to review the clarity output that we will talk about. But first, let's have a quick review of the brain stethoscope function. To activate the brain stethoscope function, you can either press on the sound on the touch screen, or you can press on the stethoscope button by the speaker. When you do that, you can listen to either left or right hemisphere at a time. If a patient is not having any seizure, you're going to be hearing something like this. Basically flat, no major rhythmic event. If a patient is having seizure, it goes into very rhythmic, repetitive, and quite unpleasant sound. So the key here for determining if a patient is in seizure is to pay attention to rhythmicity and continuity and loudness of these waveforms. Now a few words about the clarity algorithm. When you activate this button, you are asking the computer in the cloud to calculate how much seizure burden there is in a 5 minutes window of EEG. That's why it takes 5 minutes for the clarity to start working. You will see a number on the screen that basically denotes the percentage of the last 5 minutes that contains epileptiform activity. If it's more than 90%, it means over 4.5 minutes of the 5 minutes contained epileptic activity, which means there is a possibility that this patient is in status epilepticus. And here you see the trending in time. You can scroll back or forward to see how the patient has been doing since the recording has started. If the trend goes upward and reaches the 90 percentile level, it means over 4.5 minutes of the last 5 minutes contained epileptic activity or something very concerning. This number tells you exactly how the EEG is now, meaning 96% of the last 5 minutes contains seizure-like activity. If that happens, if it reaches 90 percentile threshold, the screen goes red, and at the bedside, you will hear a sound like this. That means this patient might be having seizures right now. So back to this number again. This basically will guide your treatment algorithm, as you will see in the next slide. Based on the numbers on the screen, you can decide how to triage your patient. Again, Clarity AI is like another data point. It has to be taken in the context of your own clinical suspicion. If your clinical suspicion is very high and the algorithm says over 90% of the last 5 minutes it's detecting seizure activity, then definitely this patient will benefit from a treatment, for example, a dose of anti-seizure medication. For the most part, your algorithm is going to be in this domain, less than 10%. And if your clinical suspicion was very high and the algorithm doesn't detect seizure, this is where the patient will benefit and the hospital will save a lot of money if you do not over-aggressively treat the patient. So in these cases, emergent treatment should be avoided, and you should wait for the EEG fellow to return your page with a formal read of EEG. So again, based on the clinical suspicion and the AI output, you will determine what to do with the patient. EEG will be disconnected, usually around 1 hour time point, and documentation will be completed. Here are the pager numbers for your EEG expert and on-call neurology consult. And if you have any technical issues with the device, this is the 800 number 24/7. I hope this was helpful, and I thank you for your attention.